My name is Bill Nielsen. I'm a Canadian citizen living in the U.S. The problem was a knee, my right knee. When I was 17 years old, I injured it in a high school football mishap. I saw a physician in Canada where we were living at the time, and they told me there was nothing they could do for me, but I would have problems later in life. And that was the end of it until last year. I was golfing and I twisted the wrong way and I heard a pop and my knee started to swell up and pain started to come and I was unable to walk properly and function properly. And from that time on, within 6 months period, I was handicapped. I saw a doctor, I saw medical people, did an MRI, found that the knee was destroyed and I needed to have a knee operation. And so that led to my doing research both in Canada, the US, and then to India. And India was the most economical place to be. I researched the doctors out, the facilities here, the people that we had dealt with. We contacted a company called Healthbase in Boston, who are a medical tourism company, who responded to our questions and were able to provide, to our satisfaction, the necessary information so that we felt comfortable in making a decision, because we were going halfway around the world and spending a lot of money to make sure that we were going to get the proper care. When I was in the United States, they took an MRI of my right knee, found that the knee was injured, needed to be taken care of. I also found an aneurysm under the right leg, and it was of such a proportion that the medical people here felt that it was necessary, that needed to be attended to as well. So when I came here, they did a full body MRI and found that the knee, the aneurysm on the knee, or under the knee, was not of the magnitude that it was originally intended to be. However, they did find another aneurysm in my abdomen area, and that was of a serious nature. And so it was determined at that point, after speaking to the vascular surgeon and the cardiologist, that we needed to have that taken care of as well. And so, following the knee operation, we waited a week and a half, and then they undertook the surgery or the procedure for the repairing of the aneurysm. One of the best parts about coming here was they did a full body MRI, knowing that if there's one in one place, that there possibly be maybe one in another place. And so they wanted just to make sure that there was no other areas that needed to be attended to. And we found it, and I'm glad they did. My first impression is very positive. It started at the airport with the greeting of the gentleman, the assuredness that we were going to the right facility, and the facility themselves. This room is a luxurious room for a hospital. And that my wife could stay with me. You know, that was really an intricate part of our decision making, but she was able to come with me and was included in the package that was put together. The Wolcott people are very professional. The surgeons were seeing us on a more than daily basis, oftentimes 3 and 4 times during the day. They would come in and check on us, make sure that we were adequately taken care of. For the last year, I had never walked without pain. I had so much pain, and it became worse and worse, was unable to function normally. Since I have had the operation, from day one of my starting to walk, which they got after me the day after surgery, I have not had pain in my leg. The muscles are stretching, which is considerable. There's some pain there, but not the pain in the bone. And that's just because of exercise that we're doing. And we'll continue to be that way until we become fully mobile again.